Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started.
Welcome to Rheumer Has It, the podcast that busts myths, highlights evidence, and inspires hope for living better with rheumatic disease.
Through plain language interviews with experts, we offer actual knowledge so you can thrive today.
My name is Eileen.
And my name is Cheryl.
Join us as we bust myths and spotlight evidence. And today we have a special episode continuing the 5th year of the Canadian Talk Over RA campaign sponsored by AbbVie. However, we are not discussing drugs by name, but here to educate you on what remission is. So we are so happy to have a rheumatologist from Spain that I met while attending the 2025 European Rheumatology Conference in Barcelona earlier this year. Welcome, Dr. Loreto Carmona, here to talk about remission in rheumatoid arthritis. Can you first let us know a little bit about your training and how you came to specialize in remission with rheumatoid arthritis? Because you are considered an expert in it.
Sure. Hello, everybody. So I always wanted to be a doctor. And then when I had to choose, I always wanted to have something that is related to psychology, kind of, but also immunology. So then I realized rheumatology was the perfect match for me. So that's how I came to rheumatology.
That's amazing. I also love psychology too. So I think a lot of rheumatologists are very, person-centered. They love their relationships with their patients. And I always, as a patient myself, I enjoy that. So before we talk about remission, we have to actually define what remission is. Is there one unified definition, or how do you define remission in rheumatoid arthritis?
Well, there is not a unified definition. We can say that is the absence of symptoms. Yeah. But it's not only that. It's more. And depending on whether you look at remission from a rheumatologist perspective or from a patient perspective, or even from a radiologist perspective, it might change a little. But basically, it's the complete absence of symptoms. That's what it is, more or less.
That makes a lot of sense. And just a quick follow-up question. I've heard sometimes that some patients feel like their doctor thinks that they're in remission because their blood work looks good or their imaging looks good, but the patient still has symptoms, so they don't feel like there's remission. That's almost like a little bit of one of these communication. Do you think that's like a communication issue, or have you ever experienced that?
Yeah, absolutely. So, we are all humans, right? And it's not easy. And as you mentioned, communication is a big issue in medicine. So the problem is that the symptoms of our diseases most of them are subjective. So I cannot be in your shoes, and I cannot really know whether everything is away, all the symptoms are away. You tell me that you have pain, and if I'm empathetic enough, I can say, okay, the disease is not in remission because this patient still has pain. But we have other rheumatologists who are not so empathetic, I would say, and think that this pain is not only related to the disease itself, but it might be related to other things. Like, I don't know, we talk about psychological aspects. So if you are depressed, everything can actually hurt. So I don't know whether you've ever been heartbroken, but it hurts. So if you're depressed, everything hurts. And it's not easy to know whether that is because of the disease or is it because of your depression. And there are these subtle things that, make us difficult to say whether a patient is in remission or not. But we should listen more to the patient and take that pain into consideration. Yes.
Thank you so much. Eileen has the first misconception to help clear up.
That was wonderful. And I think it is so important to address the emotional side to living with pain. So great definition there. Now, remission, there's a misconception that remission is being cured. How would you say that is untrue or true?
We wish it were true. Yes. So usually remission, only a few lucky ones have remission just forever, right? But usually what happens is that you enter into remission, you have no symptoms, and then this is usually temporary. There are some patients that can be off medication. So they can be put off the medication even for long periods of times. But the majority of them return to have what we call flares or more symptoms after a while. So we are always trying to fix the treatment so that you don't have to take a lot of treatment if you are in remission, but then be alert of the symptoms of a flare coming back. So unfortunately, it's not the cure.
Yeah, that's really helpful to know. And I think on a related note, there's also a misconception that anyone can reach remission without medication, because some people do have an unmedicated remission for whatever reason. And they'll say things like, I did it, you can do it too. What would you say to that? Is that right or wrong?
Well, if we look at the data, that will happen in less than 5% of the people. So if you are one of those lucky ones, I mean, you should know that the rest of the people are not so lucky. So you should not be, blaming on the others.
Sorry, I was going to say, do you mind letting people know a couple of the things that make someone less likely to be able to get into remission?
I wish we knew. Okay. The thing is that if we were able to predict beforehand, just by drawing a blood test or by getting some clinical record taking and say, okay, this person is going to enter remission if I put this person on this drug, or even if I don't put this person on any drug, then that will be, that's my dream. Okay. That's my dream, everybody's dream. But so far, we do not have that. It is not possible to know who is going to go well or who is not. We have some poor prognostic factors, but for good, we don't have them.
Oh, interesting. Okay. I thought I had heard, but let me know. Maybe we can correct a misconception in real time. That I thought I'd heard something that the faster that you get to your diagnosis, like, and the least amount of joints that you have affected initially, like if you only had one swollen joint and you caught it really early, then you're more likely to get in remission? Or is that a misconception?
I mean, that's a good sign. It's a good sign, but that doesn't mean that you will be in remission forever.
Oh, I see. So it's not like a guarantee. Showing us how rheumatologists are detectives. You're always having to gather evidence. I love it. Thank you so much. Okay, I'm going to let Eileen go.
No, this one actually ties right into what you were just talking about, because our next misconception about remission is the likelihood of remission is the same for everyone with the same diagnosis. So can you walk us through some of the reasons why somebody might not achieve remission right away, or maybe it takes them a long time, or maybe unfortunately they never do achieve remission?
I mean, there are a lot of research underway looking at the molecules directly in the joint. Okay. So there, at the end, it will be a combination of genetics, how the molecules behave in our joints and in our bodies, everything that happens around, say, stress, things that can trigger a flare. So usually when the disease is very clear, we can more or less anticipate, but each patient is completely different. We still are not at that point where we can say, this patient is going to get into remission, this patient is not. We can, as I said before, we can give hope, but we cannot guarantee.
That makes sense. Yeah, I think as a patient, that can be one of the hardest things to cope with is that uncertainty. We all want the guarantee, but we have to learn to cope with uncertainty.
I have a trick for that.
Oh yeah, tell me.
Yeah, because I lived in San Francisco for 2 years. And
Oh,
tell me about uncertainty. That weather, my goodness, you never
yeah.
know whether you will be able to go to a picnic or not. So a good thing is to team up with your rheumatologist and the rheumatology team. And they really are with you. They accompany you and they have the door open for whenever you think you have a flare. I mean, you can stay a long time and help you cope.
I totally agree. And I think even just saying the words out loud, like, we don't know for sure in rheumatology. Like when my doctor told me that, she's like, it's not like some other areas where we can say 100%. And saying it out loud helped me realize, okay, it's not like she's holding a secret from me or something. Because I think sometimes patients feel that way, like they just don't want to tell me or something. But it's that we're on the same team. We're partnering and I'm keeping her in the loop with what's going on with me. So I'm lucky that I've had the same rheumatologist for 22 years. Back to we always make a list here. You've already answered this implicitly, but Eileen and I talk to a lot of patients and a lot of people feel guilt if they don't reach remission. I don't actually like the word achieve remission because it's not really an achievement if it's partly luck, right? But do you agree or disagree that people who don't reach remission just didn't try hard enough or didn't do everything right?
Okay. I hate this thing about guilt. I mean, you cannot be guilty for having a disease or for not being in remission. You can do things to improve your chances of being in remission, but that's responsibility, not guilt. Okay. So, if you're responsible for your disease, if you are responsible for going to your appointments, if you are responsible for achieving a good communication, yeah, you're responsible for that, but it's not your fault. Not at all. I mean, if you're doing all your things, I mean, really.
Yeah, that makes a lot of sense.
I completely agree with you. I hate the term when you feel or just feeling guilty that I have the disease, that I caused it. And it's even interesting because some people will talk to you like, what did you do to cause this? Like XYZ person I know that managed to achieve, cured their disease with diet kind of thing. So yeah, that's really good to know that we definitely didn't cause this to ourselves. One of the most important things that patients can do is improving their communication with their physicians, especially when it comes to remission. What are some impactful questions that patients can ask their doctors about possibly achieving remission?
Hmm. Yeah, perhaps, of course, to know how their bloods are going, their blood tests, to know what are the options of treatment, whether there are still options of treatment, and of course, what can they do for themselves? You mentioned diet. Of course, you can follow an anti-inflammatory diet as much as you can, but basically it's avoiding sugar as much as you can and avoid things that you know are not good. Yeah, ultra-processed foods and things like that. You can do that. You can also do exercise. So, I mean, you can do things. Very importantly, your rheumatologist is not going to know much about diets or exercise. Okay. So I will ask your rheumatologist whether he or she can pinpoint somebody or some resources to help you with that. For instance, patients associations, they have great resources for that because we really are not good at these things.
Yeah, and luckily we've covered that on a couple other episodes too, because there's some great data out there for nutrition and other lifestyle things like exercise. And then there's some kind of a lot of myths and misconceptions.
Yeah,
So we tried to combat those. So thank you. This is another myth versus fact before we start wrapping up a little bit. I've heard that, oh, I know this is a fact, but myth versus fact, are more people in remission from RA today than, let's say, 30 years ago in 1995?
Yes, yes.
Yeah.
When I started rheumatology as a resident, most of the patients were not in remission. They were not in remission. I mean, right now, you know what is happening is that now some residents do not believe that patient has rheumatoid arthritis because they don't see the signs that we used to see in the past. So yes, it has been a complete game changer.
And it's the
for this.
medications, right? That's the game changer.
Yeah, it is the medication and the approach. Like before we were going one step after the other. Now we go really fast and then try our best and then change fast. So the approach has changed completely. We have many more drugs. So yeah, it has completely changed. Now it's a good time, to have rheumatoid arthritis. Yes.
I agree. I mean, I got so lucky being diagnosed in 2003, and I was put on early aggressive treatment right away, and I went into complete medicated remission for 6 years. The only problem with that was that I didn't understand that it wouldn't last forever, so I just thought that I figured out RA. I have my plan. I just take the same medication for the next 60 years. And then when my body changed and I wasn't in remission anymore, then that was when I had to actually understand the disease more. But anyway, I think that history is important. And Eileen has a historical story too.
Yeah, I do. So I have an aunt, or had an aunt, who was diagnosed with rheumatoid arthritis about 40 years prior to me. And I never saw her walk more than a few steps. She was mostly in a wheelchair. She had the deformed hands. And rheumatoid arthritis devastated her life. She was treated before the times of DMARDs or biologics. In fact, when they used gold to treat rheumatoid arthritis, or just had you kind of rest all the time. They told you don't exercise, and you were kind of just sort of forgotten about, kind of left there. And now, having been involved with research with Arthritis Research Canada and going to all the different rheumatology conferences, it's really interesting to learn how they are actually starting to see less and less deformed hands, less joint replacements, less wheelchair use. Unfortunately, this isn't for everyone, and there's many different reasons to use a wheelchair or mobility devices. It could even be side effect related. So I think it's just something really to kind of highlight how far medication advances have come in the last, particularly 25, 30 years. And unfortunately, my aunt passed away the same week I was diagnosed from heart disease, which was a complication of her untreated rheumatoid arthritis. So that's actually one of the reasons why I am an advocate today.
That's amazing. Thank you, Eileen, for sharing that story. And I wanted to know, Dr. Carmona, is there, as we start kind of wrapping up a little bit, in one sentence, what is the most important takeaway you'd like someone to take from this episode?
I would say that remission is possible if we are all in the same team. And we stop there. I think it's possible if we're in the same team. Yeah.
That's wonderful. Awesome.
I agree. I say that it takes a team to treat rheumatoid arthritis, and your team involves rheumatologists, it involves social workers, psychologists, psychiatrists, occupational therapists, physiotherapists. I'm sure there's others, with the
the family.
Your social support for sure. It definitely does. Now, if people want to learn more about remission, where do you recommend they go?
I mean, we have now the Global Alliance for Remission. I think that's a good place to go. The Global Remission Alliance, I think, is globalremission.org. So
yes,
you can, So you can probably go there because we have a lot of things. It's remission not only in rheumatoid arthritis, but in other diseases, autoimmune diseases.
We cover rheumatic diseases, but today's on rheumatoid arthritis for the campaign that we're kind of involved in with here. But yes, remission, we're talking about with rheumatoid arthritis, can be applicable to many other rheumatic diseases.
Yeah, that's super helpful. And what if people want to follow up specifically with you? Do you have a social media handle or LinkedIn you can share?
Yes, of course. I have LinkedIn. They can find me easily, Loreto Carmona. And then I also have Blue Sky now.
Nice.
Yeah.
Awesome. I'll have to find you there too if I haven't already.
Yes,
All
I
right.
usually take questions, so I'm okay with that.
Well,
Yeah.
thank you. That's good to know. All right. Well, thank you again for listening to another episode of Rumor Has It.
Don't forget to check out the full show notes on the Arthritis Life website, which is at myarthritislife.net, for a full transcript plus a video of our conversations.
Thank you so much for being here, Loreto. It has been an absolute pleasure getting to speak to you again. And thank you for doing such great work in the rheumatology community. We would also like to hear what you think of this episode. Shoot us an email or comment on our social media accounts.
Awesome. Thanks again, and bye-bye for now.
Thank you.
Thank you so much for listening. This podcast is supported by Room to Thrive, an educational program I created to help empower you to live life to the fullest with rheumatic disease. In the program, you're going to learn evidence-based tools for managing all the ways rheumatic disease affects your life. And my goal is to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded modules on your own in the self-paced course, or you can take the course along with a robust support group of new arthritis friends to support you and cheerlead you along the way. Learn more in the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I'd be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also want to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on the Arthritis Life website, plus full episode videos on the Arthritis Life YouTube channel. If you have any ideas for content for future episodes, or you want to share your story on the podcast, please send me, Cheryl, an email at info@myarthritislife.net. I can't wait to hear from you, and thanks so much again for your time.